Hi there, everyone. Thanks for tuning in. I'm here today with Dr. Jackie Jones, DVM. She a veterinarian at Oakton, Vienna Veterinary Hospital. Dr. Jones and I have a bit of a past. We were actually neighbors in Springfield. She is the only one I trust to take care of my German Shepherds. Everybody knows that I'm a big dog lover, and they love her too. They don't even blink about going to the vet. They're happily trot in. They love all over her, and she loves all over them. So welcome, Jackie. Thanks for taking time out of your busy schedule for Dr. Jones, sorry, for chatting with me today.
Sure.
Tell everybody how you got started as a veterinarian. Where does this go back to?
Probably my whole life, because I've always liked science. I've always liked animals. So I knew I was going to end up doing something with those, like a zoologist, a biologist, animal trainer, and veterinary medicine probably really became the focus when our family dog grew Gypsy. She was a little wire-haired fox terrier, and she developed a limp, and I could feel that her leg was thickened, and I was worried that it was cancer. And my parents took her to the veterinarian, and she was diagnosed with cancer. And that was my pivotal moment of thinking, I can do that. And that's when veterinary medicine became the focus.
So how old were you when that?
I was probably 10.
Oh my God. So where did you go? Tell everyone where you went to veterinary school and that background and where you started, because you have kind of an interesting tale about that.
Well, I grew up in suburban Maryland, and I went to University of Maryland. I was a Terp. And then I went to Ohio State for veterinary school. Then I wanted to do horses. That was my love. And I rode, typical girl, with her horses. And so I wanted to do horses. That time and this time, track racing isn't so great when you actually love animals. So then I determined that, okay, I didn't want to do just horses. I would do mixed animals. So I ended up in California in the mountains doing mixed animal, which was a great first job because it was such a breadth of experience that you could never, I probably got as much experience in 1 year working there than many veterinarians would get over a whole career. It was, it should probably be one of those Animal Planet shows.
Tell everyone, because I didn't even know this, tell everyone the differences, the different types of veterinary medicine, because there is a distinction that even I didn't know about.
Right. Well, veterinary medicine is very much like human medicine, where there's so many different aspects of the field that you can do. There's clinical medicine, like what I do, where you see patients and you're their primary veterinarian, and that can be it's broken into groups of small animal, which is dogs and cats, exotic animals, which are birds, reptiles, fish, all the small mammals like rabbits and guinea pigs, horses, and then food animal or large animal, which are cows and sheep and goats. And there are clinicians who are just the primary veterinarian. And then there's specialties, just like in human medicine. You can have oncology, orthopedic surgery, ophthalmology, neurology, all the specialties. And there's research, there's pharmaceutical, so there's a lot of jobs in veterinary medicine where you're not seeing pets or animals and diagnosing them and treating them. You're doing the work on the research side or studying drugs and how they work or don't work, regulations. So there's both the hands-on and the back office, I call it, side of veterinary medicine.
Interesting. Yeah, I never knew that really, except when we had a pet iguana and we couldn't find somebody to treat him. He swallowed a dime. That's a whole other story. Can you give some advice to pet owners, just some overarching advice about how they can help keep their pets healthy and avoid any illnesses, just regular checkups and whatever?
Oh, sure. The two biggest things that you can do as a pet owner to keep your pets healthy and living as long as they can, number one is to keep them at an ideal weight. That has been shown to lengthen the life of a dog by years.
Wow.
I think we have this little graph over here that it was 2 years in Goldens that they studied, 2 extra years on average for the ones that were considered ideal weight. And so that's a really, really big part of keeping them healthy. And the second thing is to get at least once a year physical exams by a veterinarian, because there's so many things that happen with your pet that you can't see. Things that we feel on a physical exam, or when we look in their eyes or their ears with our scopes, or listen to their heart and lungs. You can't do those things at home. And we'll pick up on things hopefully very early on so that there's easy treatments and preventions that can be done.
I know that firsthand, as we know, with my older gal, Sheena, who had a little lump that seemed innocuous, but it turned out it was cancer, and Dr. Jones was diagnosed that and pointed us in the right direction to get some supplementary treatment. So that was great. Yeah. Sad, but I am grateful. Dr. Jones, talk to us too about, I know you're a big advocate for girls pursuing careers in any of the sciences. And I can share that when I was teaching, I was also part of a STEM mentoring program for girls, elementary age girls. And Dr. Jones, tell us what you did to help with that.
So yeah, that was fun. I went to Doreen's after school group that she did, and I brought x-rays, and this was, luckily we still had the film x-rays, you know, now everything's digital, but I still had some of the film x-rays, and we got to use, and I brought some bones, some other specimens for them to look at, and talked about what a veterinarian does, what kind of schooling you have to go through to be a veterinarian, and then just showed them the different things, talked about different things that can go wrong with animals and how we treat them. They were all like very interested in all of that. It was kind of fun because since we had the film x-ray, we had to figure out how to show it to them. So luckily it was a sunny day, so we were able to put them on the windows. They were all looking at them and thinking it was really great.
Oh, they talked about that day forever. They did. They really enjoyed your visit. And it was a program designed for girls and having women in the sciences to come and mentor and talk about their experiences. Have you seen big changes since you became a veterinarian in terms of women in the profession?
There's more women now. My class was the first one to have the majority women, and it was, I think our class was maybe 55 or 60% women, and the class after us was 70% women.
Oh, wow.
So more women are being veterinarians now. So that was a big change.
Yeah, that's great. Before we go, tell us about the craziest, funniest, or biggest challenge pet or visit you had? Yeah. Can you share any funny, challenging, unique?
Well, challenging to examine. I've had to examine one very poisonous lizard called a Gila lizard. They're native out in the Southwest, and I had to examine that. I had to examine a snapping turtle.
Oh.
So that was challenging to not get your finger bit off. So those were, and a bat. I wasn't so thrilled with the bat, but only because of the rabies. It was a wild bat, so there was no way to know if I had rabies or not. So that,
I didn't know you were allowed to have those as pets. Are you allowed to have a bat as a pet? I wouldn't think so.
You know, it's California.
But you can have anything you want in California.
Yeah, those were kind of challenging. And then fun stories, you know, probably my best fun story is that I actually got to go to Never Land, which is Michael Jackson's ranch in California, to look at one of his elephants that had a bad knee. And it was, I was in a group of people, but that was probably my most, you know, what is it, the 6 degrees of separation. So see, now everyone watching this now has 2 degrees separation from Michael Jackson.
Okay, so I never knew that, and I've known you a long time. I never knew that. Glad I asked, the things you learn. And one last thing, because of this pandemic, I know that you guys had altered your procedures. So just quick talk about how you guys are moving forward. You're in your office obviously today, so your clinic.
Sure, exactly. Yes. Yep, we're still seeing our patients, taking care of them, and we're doing curbside appointments where the owner comes, they call us from the car, we get all the information, the history, an assistant goes out, gets the pet from the car, brings it in, we do our exam, we do whatever services we need, and then the doctor talks to the client over the phone, and then we take them back out and check them out. So it's a little bit removed, but you know, it's what we can do that's the best for the clients and for the staff, and still get the pet seen. And then we also do admissions where owners can drop their pet off and leave them for several hours for the day, because a lot of people are doing homeschooling with their children, the video schooling, and a lot of people in this area are telecommuting because the government is a big employer in this area, so a lot of people are still working their 9 to 5. So it's helpful to just be able to shoot over to us in 5 minutes, drop their pet off, go back, continue their work, and then come back later and pick up their pet. So we're still pretty much same every day, except for there's no clients, which is odd.
That's odd. Yeah. Yeah. I know you're really busy, Dr. Jones. I appreciate so much that you took the time out to talk to me today. And anyone who lives in Springfield, you'll see Dr. Jones walking around, but don't ask her there for pet advice. You'll have to call her at her office. So thanks again, and thanks for being such a great contributor to the community and doing what you do. We all love our veterinarians.
Oh, thank you. Anytime for you, Doreen. And give Sheena a kiss on her nose.
I will. And Sadie will go ahead and give you a lick.
You know, Sheena's here the most.
I know.
I do have my favorites.
I know. All right, Dr. Jones, take care, stay well, and we'll see you soon.
All right, bye.
Bye-bye.